assessing the IV insertion. So this procedure is a medical technique that delivers fluids, medication, and nutrition directly to the patient's vein. So this procedure requires parenteral fluid, which is our solution, and a special equipment such as administration set, the IV pole, the filter, the regulators to control the flow rate, and an established venous route. So, in assessing the IV insertion, first thing that we are going to do is we are going to check the doctor's order. So here, we are going to check or note for the IV fluid to be used and the ordered IV rate of the patient. And then next is we are going to wash our hands. So I'm done washing my hands. So next is we are going to prepare all the materials needed for our IV insertion. So the materials that we are going to use are the following. So first thing we have here is our macro set. So this is used for adult patient and this releases for about 10 to 20 drops per ml. And aside from that, we also have here our micro set. So this is used for pediatric patient or for medication that needs to have a small drop rate. And this releases for about 60 drops per ml. And if we are going to open this, we are going to see in the middle that it has a needle. So next is we have here our hypoplaster, then our IV starter kit, which contains tourniquet, then our alcohol swab, then we have our sterile gauze dressing, and then lastly is our improvised betadine swab stick. Then we also have our cotton balls, our waste receptacle, our gloves, 2 pairs of gloves. So aside from micro set, we have also a solu set. So this set is being used for pediatric patient where it has a volumetric chamber wherein the fluid will just go here. So this set is an infusion set which is used to administer therapy or medication wherein a liquid substance is delivered directly into the patient's vein. So lastly is our IV fluid here. So this is a lactated ringers. So upon checking the doctor's order, is we are going to compare the IV solution to the doctor's order. So we have to check for its expiry date, and we also have to check for the fluid if it is cleared. So next is we are going to prepare our IV label or tag. So in the IV label or tag, we are going to write the name of the hospital, the name of the patient, the room number of the patient, the name of the IVF, if it is lactated ringers or any solution that being insert or infused, and then the medication infused, if there is any medication added to this fluid, and if none, we are going to write here none. And then next is we are going to write for the IVF rate. If the doctors ordered 120 ml per hour, we should write it here. Then the date, the time, and the name and the signature of the nurse assessing the IV insertion. So next is we are going to prime the IV fluid. But before that, I am going to wash my hands, or we can use an alcohol. So now we are going to open the protective cap of our IV fluid. So this IV fluid should be sealed with a cover, and we have to observe if it is completely sealed here. And then we are going to open it. in the IV fluid, there is a cover ring where we are going to remove it. So upon opening the IV cover, we should not touch this area here because this area is sterile, and if we accidentally touch this area, we are just going to disinfect this area with a alcohol swab. So after that is we are going to get our IV set. So we have here our micro set. Since our patient is only 13 years of age, so we are going to check for the expiry date and check if it is sealed. And if it is not sealed, we are not going to use this set because we have to make it sure that this set is sterile. Then after that is we're going to open this. So here is our micro set. So we have here our spike. This is what we call spike. And if we are going to open this, you can see this. We should not touch this area because this area is sterile. So we have our drip chamber where the fluid enters, and then our tubings, this, and our regulator. So if our regulator is in upward, this means that this is open, and if it goes down, it means that this is closed. So we have here our end port and our injection port here. So next thing that we are going to do is we are going to close the regulator like this. It is to protect air from entering into tubings. And aside from closing the regulator, we can also kink this area here to ensure that there is no air will come to the tubings. Otherwise, the air will go to the patient that could put them to danger. Then we are going to remove the protective cap of our IV set needle or the spike, this one. Then we are going to insert the IV set needle into the rubber port of our solution bottle. It is to enable the fluid to flow. Then we are going to invert the IV solution. Then we have to fill the drip chamber halfway with IV solution by pressing lightly on it, like this. So as you can see, it is filled with halfway fluid. Then we are going to hang the IV bottle into the IV pole. So next thing that we are going to do is we are going to open the end port. So we have to make it sure that it is still sterile and let it drain into the sink while touching the end port. Then we are going to open the regulator. It is to fill the tubing completely with solution, and it is also to get rid of the air. So if it is already filled with fluid and there is no air on it, we are going to close the regulator, and then we are going to cover the end port. Then we can now bring the equipment together with the prepared IV solution at patient's bedside to provide an easy access for the equipment needed. So after we bring all the equipment necessary for IV insertion, is we are going to introduce ourselves to the patient, and we are going to check for the identity of the patient, as well as we are going to explain the procedure to her. And then we are going to position the patient in a comfortable position. I am Mary Rose Nian Pausal, your nurse for today. May I know your name and date of birth?
Joanne Pausal, May 2007.
Okay, so with me, ma'am, he is...
So, hi ma'am, I'm Roger P. Pausal, your nurse therapist, and I will be the one to insert your IV fluid.
So by the way, ma'am, there is an order for your doctor that you will be start with the IV solution or IV fluid. It is to correct the fluid loss that you have. Would that be okay with you?
Yes.
Okay, so are you left-handed or right-handed?
Left-handed.
So is it okay with you that we are going to start the IV line in your right arm?
Yes.
Okay, thank you. So after the patient's approval, we are going to place the patient in a comfortable reclining position, leaving the arm in a dependent position. It is to increase the capillary feel of the lower arm and hand, and it is to give comfort to the patient. So, if the patient's arm is cold, we are going to warm it by rubbing or stroking the arm, or we can cover the arm by warm packs for about 5 to 10 minutes. It is to relax the patient. Then afterwards, we are going to place the IV pole in a proper slot or into the patient's bed frame. So since we are going to start the IV infusion into the right arm of the patient, we are going to place the IV pole into the patient's right side. And then after that is we are going to hang the IV bottle into the IV pole. It is to facilitate the flow of the solution. And make sure that the tubings will not be contaminated or touched into the floor. Then after that is we are going to don on gloves as well as the IV therapy nurse. It is to protect ourselves from the body fluids or blood since we are going to insert an IV. So after that, the IV therapy nurse will going to select a site for IV insertion.
So let's let's find a site. So hey ma'am, can you do this? Okay. Okay.
So I am going to get the tourniquet and give it to the nurse. It is to tie it to the arm of the patient. So once the IV therapy nurse find the proper site for our insertion, we are going to wipe the arm or clean the IV insertion site with povidone iodine, or we can use a alcohol. So we are going to clean the arm in a circular motion from inside to outside. Just like this. It is to reduce the transmission of bacteria. So we have to make sure that we are not going to touch the clean area, and we are going to instruct the patient to do so. It is to reduce the transmission of microorganisms, or it is to reduce contamination. So after that, we are going to get the cannula and give it to the IV therapy nurse. But before that, we are going to open it by peeling or opening this area like this. So this is our 24 gauge IV cannula. So as you can see, this is the butterfly part or the wings of the cannula here. So we are going to give it to the IV therapy nurse while facing the needle towards us. So we are going to remove the cover. Then we are going to prepare our sharp container, because this is where we are going to dispose our needle. And then after that, we are going to prepare the plaster and the tubings. So once the IV nurse hit the vein, we are going to put an initial tape on the IV cannula. To secure the device at the same time, the IV therapy nurse is pressing this area so that the blood will not ooze on this area. Then we are going to open the end port, this one, and connect the cannula. So we are going to remove the tourniquet. Then we are going to put tape on this side and on the other side. After that is we are going to open the regulator. It is to make sure that the IV line is patent. And it is to regulate the flow rate. It is to prevent the circulatory overload. So this is open. So after that, we have to loop the IV tubing on the patient's limb and secure the device completely. So we have to put tape on here. Like this. And the upper. And so this is to prevent the catheter to be dislodged and to avoid any complications. So afterwards, we are going to adjust the flow rate as ordered by the doctor. So the doctor ordered 40 drops per minute. So we have to regulate 40 drops per minute. So afterwards, we are going to dispose the needle into the sharp container, our improvised. So we have to dispose the needle into the sharp container. It is to prevent any accident to the one who will collecting the cartridge. So after that is we are going to label the last piece of tape. So we have to label the fluid with the name of the hospital, which is Chonghua, and then the name of the patient, the room number, the name of the IVF. So we use lactated ringers, and then the medication infused. So there is no medication infused, so we have to put here none. And then the IVF rate, which is 40 drops per minute. Then the date, April, then the time, and my name and signature. So we're going to put it here because this will serve as the baseline for documentation and serve as an endorsement to the next nurse on duty. So after all the procedure is we're going to remove our gloves and dispose it to the waste receptacle. Then after that is we're going to do aftercare. So after cleaning all the materials or equipment, we are going to wash our hands. So as if that I'm done washing my hands, and then the last procedure is we are going to document the procedure. It is for legal documentation purposes. So in discontinuing the IV fluid, first thing that we are going to do is we are going to check the doctor's order. So here is the doctor's order. It is to make sure that the correct patient is right, and it is to check the order to discontinue the fluid or the IV. So next thing that we are going to do is we are going to prepare all the necessary materials. It is to save time and energy. So the materials that we are going to use, first we have here our gloves, our plaster, this one, then our alcohol or alcohol swab, and then lastly is our dry cotton balls. So after that is we are going to bring the materials needed into the patient's bedside. It is to provide an easy access for the materials that we are going to use. So now we are going to introduce ourselves to the patient. and we are going to check the patient's identity, as well as we are going to explain the procedure to her. So good morning, ma'am. I am Mary Rose Leon Pausal, your nurse for today. So may I know your name and date of birth?
Joanne Pausal, May 2007.
Okay. So today, ma'am, there is an order from your doctor that we are going to remove the IV fluid because it is no longer necessary for you since the IV fluid or the fluid loss has been already corrected. So this procedure, ma'am, is not painful and it will only take a minute to remove it. Would that be okay with you? Okay. So the next thing that we are going to do is we are going to plug the IV tubing. It is to stop the flow of solution. Then after that is we are going to wear our gloves. So we have to wear it. It is to protect ourselves. So after we wear our gloves, next thing that we are going to do is we are going to gently remove the tape from the skin here. So since this is an adhesive one, we are going to use our clean cotton balls soaked with alcohol, or we can use alcohol swab. So we have to observe the direction of the hair of the patient. If the hair is going to the right, of course, we are going to remove the plaster in this direction or into the right direction. But if the patient's hair goes to the left direction, the other side, we are going to remove the plaster into the left direction. So we are going to remove it. The purpose for applying alcohol, it is to reduce the pain and removing the plaster. So after we remove all the plaster, we should be ready to the cotton balls. So we are going to slowly apply the cotton balls. So we are going to apply firm pressure on the side for about 1 to 2 minutes after we remove the plaster or until the bleeding has stopped. Or we can instruct the patient to do so if the patient is unable to do. So after that is we are going to roll the tubing like this. And then we are going to dispose it together with the IV fluid. So after all the procedure is we are going to remove our gloves and then discard it. Then we are going to do aftercare. After doing aftercare, we are going to wash our hands. It is to reduce the transmission of microorganisms or the bacteria. And then the last procedure is we are going to document the procedure or do documentation. It is to serve as legal purposes. So that would be all, miss, for the procedure for assessing the IV insertion and removing the peripheral IV line. I hope you're having a good day. Thank you and God bless.